So when it comes to aging, I would imagine eyes are kind of the first place that we see signs of aging, and then maybe like jowls. I know that a lot of, yeah. So let's talk about that, because I think, that's where a lot of like the radiofrequency comes in, and threads and filler, and using filler to try to lift the jowl. And what are non-invasive or less invasive options before it's time for surgery? You have an amazing
jawline. I talk about this all day. Thank you. I have both my parents age very well, and I have thin skin. But my dad's 65, no jowls. My mom is 63, barely any jowls. So I think it's my genetics. My sisters and I all have very strong jawlines. But there is only so much we can do at a med spa with jowls. I have this conversation all day, every day until I have dry mouth. And so a lot of it is just, we turn to surgery for it. I can, pre-jowls are starting. We could put minimal filler to just kind of camouflage them, maybe a little bit of radio frequency with microneedling to dissolve a little bit of minimal. But really all we can do is camouflage. There is nothing, and I repeat, nothing in a med spa that is going to physically pick up your skin and lift it. I don't care what anyone tells you. It's not going to happen. So there is a point where you just have to turn to surgery. And that can be like Ben does his
weekend lift.
The weekend lift.
Yeah.
I have 3 patients that I referred to him to go do it. Young, in their mid-40s, looks phenomenal. A patient that's 46 and flew to Jacono in New York and had it. It looks phenomenal. She has jawline of an 18-year-old. She's 46. But it needs to be, all this whole facelift with Botox, neck lift with Botox, the Nefertiti lift. Yes, if you have, certain individuals have very strong platysma bands. You do it, they'll get a minimal lift, looks nice, but it is a realistic lift. You are not going to, if only all providers were on the same page and we just all stopped saying you're going to get a facelift with Botox, because they're not. And yes, one of your patients might have had a great result because they had stronger bands and you you relax them with Botox and they got a nice lift. But it does not apply to everyone, especially if it's sagging skin and it's not just the muscle pulling down. And I don't want to toot my own horn, but because of the fact that I had 4 years of experience with a surgeon who did surgery in the mornings and injected 9 to 5, and I was able to hear him do consultations all day, I really understood what needs to be fixed with surgery and what can be improved with filler. And it's not just, here, I have a syringe in my hand and I can just fix it all with filling your face.
Right. Like when all you have is a hammer, or when all you have is everything's a hammer. I know I'm butchering that.
What was it?
What is it?
If all you have is a hammer, then everything is a nail.
Or the other way around.
Or something like that. But that's... everything is a nail when all you have is a hammer,
when all you have is a needle, then everything is...
Yeah. And that's not true. And I think that being honest and telling someone, listen, you don't want to spend $1,000 on a syringe right now and get... Look, if money came easy to you and you don't care about that $1,000, and even a 20% improvement is going to help, let's do a little bit. But you're really not going to get that wow factor. And it's a stab at my ego if anyone looks in the mirror afterwards and they're like, oh, this was it. So it's a lot of it has to do with the consultation. You just have to set realistic expectations.